card. Well, this is an ultrasound study of 28 years young female with the history of groin pains, backache, no lab profile available as usual in our society location. Now, if you see that there is one cystic area seen at the upper pole, at the lower pole, and there is the other cystic area that is seen at the upper pole of the right kidney. We are evaluating the right kidney in a longitudinal section. Now, the cyst at the upper pole measures 32 millimeters, and rest, if you see that all of the liver medullary region is occupied by dense, coarse, echogenic areas, and this is, you see, this is the cyst at the upper pole, and this is smaller cyst at the lower pole. No central sinus echocomplex is seen, and here you see this is a calcification. These are all giving posterior shadow. Now this is another. This is the another one, and these are the other the lower pole at the posterior parenchyma of the kidney. Now, what about the parenchymal thickness? Cortical thickness and corticomedullary differentiation. As you see that at the anterior mid region, this small cystic area is the pyramid, upper area is the cortex, and the parenchyma in this region measures approximately 10.6 millimeters and is preserved. And the reason why this patient has no other complaint, no vomiting, no weight loss, no anemia, the cause is that the corticomedullary differentiation is intact, and if we compare it with if we compare the echogenicity of the kidney with the adjacent liver, then the echogenicity of the parenchyma is less as compared to the adjacent parenchyma, which is with the normal. लंबा सांस लेके बेटा सांस रोको. लंबा सांस लेके सांस रोकिए. Now you see that सांस ले लो. This is the capsule, this is the cortex, and compared with the echogenicity of the normal liver, this is the normal liver. So the echogenicity is slightly less as compared to the adjacent liver parenchyma. So this is the expected norm. So the liver renal parenchyma is normal. Its thickness is preserved. This is the medulla. Now remember, this is the medulla because you are seeing a tiny linear structure anterior to it. This is the arcuate vessel, and this is the cystic area. And the lower pole and the cortical and the parenchyma in this region measures 13.1. So with preserved corticomedullary differentiation, preserved echogenicity of the cortex, and preserved medulla, and these all echogenic areas, densely coarse echogenic areas that are in view, are suggestive of, in a 20 years old female, of medullary calcinosis. This is how a medullary calcinosis will appear to you. Let's get a better view. This is a better view. See, these echogenic areas are not in the central sinus echocomplex. Rather, they are in the anterior, at the region of the anterior medulla, and the region of the posterior medulla. This is the posterior medulla, posterior parenchyma, and they are shadowing, though usually in typical cases, however, we will not see shadowing. Now the largest of these echogenic areas, calcified areas, it measures approximately 11.3 into 5.6 centimeters. Now if this is a case of nephrocalcinosis in a 20 years old female with the only complaint of backache and loin pains off and on, then it is a bilateral condition. Now here you see this is the left kidney, and you can see that in the left kidney, same findings that we saw in the right kidney, we are seeing over here. See, this is the lower pole, this is the mid region, and this is the lower pole of the kidney. Now the cortex echogenicity is normal. This is the medulla, tiny tubular area seen anterior to it. Echogenic is the arcuate vessel. Now this is the parenchyma, and the parenchyma and in the anterior mid region measures approximately 11.6 millimeters in this particular case, and the parenchyma at the upper pole measures approximately 12 millimeters. So the parenchyma thickness is normal, echogenicity is normal, medulla are seen, and intact corticomedullary differentiation is seen. The kidney measures approximately 11.6 from this scanning plan, and 4.0 centimeter within normal, and you can see there is no central sinus echo complex, no hydronephrosis. You can see echogenic dense force, echogenic areas, globular, and this is the other one throughout the anterior medullary region as well as the posterior medullary region, which is consistent with medullary calcinosis. So there are a few cysts also seen in this case. Here one cyst is seen in the region of the anterior parenchyma, the upper pole, and the other one, a few other are seen, smaller one though, at the lower pole, measuring approximately again 11 into 11.4 millimeters. One of these is seen in the anterior medullary region. Don't confuse this area with the medullary pyramid. This is a cystic area in the anterior mid region of the parenchyma, and this is not unusual to be seen in cases of medullary calcinosis or medullary sponge kidneys. So this is a case of medullary sponge kidneys in a 28 years old young female. Now we did not measure the right kidney, so let's get a puzzle. Now let's measure this kidney to see if it is normal in diameter. Here we are. From pole approximately 10.8, anterior posterior diameter is 4.9, normal in dimensions. Now there is, you see, this is the gallbladder, and as you can see, this is the gallbladder, and the lumen is full of echogenic particles. So these are all calculi within the gallbladder, and this is the case of cholelithiasis as well. This is the portal vein. So this is the portal vein, and this is the common bile duct. Now you see that this is the right renal artery in transverse section, because you will see it between the IVC and the aorta. This is the IVC, this is the aorta, proximal. And you can follow it up to the kidney. This is the transverse section of the kidney. This is the transverse section. Sit here, beta. Now the pelvic region, I'm sorry, in the pelvic region, this is the urinary bladder, this is the uterus of this young female, and you can see that there is a clear cystic area that does not change its shape with the movement of the probe. Now this cystic area is in fact right ovarian cyst that is clear of any echoes, septa, no calcification, no solid element is seen, thin wall with posterior wall enhancement. Here you can see this is the uterus in transfer section, this is the endometrial canal, normal central, this is the urinary bladder. So this is a case of medullary calcinosis, number 1, number 2, cholelithiasis, and number 3, right ovarian cyst, measuring approximately 6.3 centimeters by 4.4 centimeter by 4 centimeter with an approximate volume of 59 or 60 ml. So this is the case of the day. Thank you very much.